Welcome to the Heart of It, where we take you to the heart of healthcare. This season, we're exploring what happens behind the scenes at Fraser Health to ensure patients receive the best care possible. Fraser Health provides care on the traditional, ancestral, and unceded lands of the Coast Salish and Inklakatma nations and is home to 32 First Nations within the Fraser Salish region. Fraser Health is dedicated to serving all Indigenous people and honors the unique cultures of the First Nations, Métis, and Inuit living within the Fraser Salish region.
Welcome to the Heart of It, where we take our listeners to the heart of healthcare. In this season, we're taking a look at behind the scenes of what's going on in healthcare in Fraser Health. And today I'm privileged to be joined by Dr. Grace Park, who's our Regional Medical Director for Home and Community Care, as well as Paramjit Rai, who is a resident care aide for South Asian Older Adult Day Program. Really happy to talk about what keeping seniors healthy and free of frailty looks like. So with that, I'll start with welcoming both of you. Thank you for being here.
Thank you for having us.
So first, maybe I'll ask Grace, if you could talk a little bit about what does frailty mean and what does preventing frailty look like?
So frailty is known as a common definition of increase in vulnerability due to age-related accumulation of health deficits, leading to a decline in function and decline in resilience in an older adult, which can result in adverse health outcomes. And we see that with our elders that are frail, that they don't recover from incidents that happen to them on a day-to-day basis or as a result of acute stressors in their lives. So what do they look like in the community? You may see them as having lost weight, especially muscle mass. They're starting to slow down. They might need aids because they're losing their balance. They're getting tired easily. And you'll see them actually not being able to recover from things like the flu that we normally recover from very quickly, but they might not recover even over time back to where they were at before. So frailty is a very important issue. And the good news is that if you can intervene early, there are things that you can do to actually delay that frailty or even prevent it altogether. So we have lots of studies showing now that healthy lifestyles and support in the community can actually reduce frailty that older adults have to live with.
And you led some of those fantastic studies from my recollection, Grace. And one of the surprising, I think, findings was around social connections and the importance of those connections.
Yes, and social isolation is a real issue that we have to think about. So social isolation refers to the number of connections that an older adult might have, number of interactions they may have in the community in a given period of time. And the quality of those interactions are so important because lack of quality in those interactions will lead to loneliness. And we have lots of studies now showing that social isolation and loneliness is actually really harmful to the health of the individual. It can lead to a 50% increase in the incidence of dementia, as well as depression and even early death, and certainly detrimental to chronic conditions that older adults may be living with and their inability to recover from incidents, as I've said earlier. And so social isolation is something that we really do have to target and really address those social determinants of health and equity and making services available to them.
And as you mentioned, loneliness, isolation is a really key factor in terms of people having some of the life events that lead to, I think, sometimes decline in health and their ability to live independently. And one of the things that we have in Fraser Health is that we are a cultural melting pot, so to speak. We have 40% of newcomers and 90% of refugees that settle in our region, one of the largest being South Asian population. I know that we actually provide quite a wonderful program called South Asian Mobile Day Program. Paramjit, are you able to speak about it a little bit?
Yes, yeah. As a South Asian Day Mobile program, we are providing people who is like our senior, they are home, they are isolated, like they are being a home. So this is the right support. They can connect with the people and they are same age, and also they have a communication, same language, same food, like belong to India food, so they can their own language. And then we do so many activities for fun, and then they feel active, they feel connected, yeah, and mobile.
That's wonderful. And Grace, uh, the adult day programs, of course, there's Focus One for South Asian population, but other adult day programs as well, right?
Yes, and that's run under the home care program in Fraser Health. We do have limited space, but we actually lost a lot of participants during the pandemic, and now we're getting them back gradually. And so these events, day programs occur sometimes in facilities that have campus of care. They might have long-term care or assisted living on site. So older adults can come and actually experience the services that are provided there. And then they participate in activities, much like what Parm was saying. So they'll have exercise programs, they'll have mind games, they'll have guest lecturers come in and talk about topics that are important for older adults. You know, things like adult guardianship issues, abuse issues. So those informative sessions are very well welcomed. And so the day programs are very popular, and certainly they are really important for the family caregivers because it provides the family member with some respite, because they know that their partner or their elderly mother can participate in an activity that's supervised and supported while they take some time out for themselves, which is so important for them.
Yeah, it is true. Yeah.
And you see that as well.
We see this a lot, and then they can do their others work, and then the family can spend their time with other works, right? So it's a respite. This is very big help for family. Yes. Yeah, and also for seniors too. They can, they can see the world is out there too. For them, this is not a matter. They are old and they can't join, they can't do stuff, but there is a lot to do. We try to encourage, we try to tell, yeah, there is more stuff you still can do. You are not as old. Like I always tell my seniors, like and then I say there is no age limit. So when we are here, nobody's old and nobody's young. We are here for fun. Just make the day. They really love it.
So enjoying life regardless of your age, and then at the same time providing respite for families. What are other home-based supports that are available, Grace, that we offer?
So the home care program provides a lot of services, and depending on the level of frailty, is tailored to the individual's needs. So we have a program called Reablement, which is really important for people that may have had a recent hospital visit or some elective surgery. We provide supports at home so that they can recover with rehabilitation. We might have a physiotherapist come in and show them exercises, and we might provide them with other means so that they can actually recuperate following that admission to hospital. And we also have other professionals that can support older adults with their frailty. So if we know that a person is at risk for falls, we can have occupational therapists go in, do an assessment of their homes, make sure they have grab bars and they've gotten rid of scatter rugs that would actually be a hazard for falls. And we also have community pharmacists that can help individuals with their medication management, and social workers that can also help as well. And all of these individuals can communicate with the family doctor to let them know what's been happening in the community.
And how do people access these services? Because I think often, as you mentioned, seniors might be at home with their families. The families might start to notice that they need a little bit more help than before. Adult day program might be giving them a little bit of respite, but afterwards, I think most people are unaware how and where they would even look for this sort of help.
If a patient has an older adult and family givers to have access to a family doctor, that's a really great point of entry, because they can actually talk about what their health situation is and what sort of needs there might be. And if the family doctor recognizes, or a nurse practitioner in primary care recognizes a need for socialization, for activity, they can make a referral to the community organizations like Archway. And we have a program called social prescribing that can allow the family doctor to make that referral. If there is a greater need, and if they actually need some help in the home to be able to stay in the home and remain independent, they would make a referral to the home health service line, and that would give them access to the home health nurse, who can actually do a fulsome assessment to see what other kinds of services would be appropriate.
And you mentioned some of the other services that they might be able to garner at home, like home support.
So we can have the reablement, the professional services that I spoke about earlier, and then if there is a need for personal care assistance, like dressing or bathing, we do have home support available. So a care support community health worker will go into the home, depending on their need, help them with their showers, their bathing and dressing. Medication management also can be provided if a person is forgetful with their medications, etc. That can be supported. So those resources are available to really support the person to remain in their own homes for as long as possible, remain independent. And then now with social prescribing, we can actually address some of the social needs as well and connect them to community organizations and programs like the wonderful program that Parma's talking about.
Can you talk a little bit more about social prescribing? What does it look like? What are some of the examples of it? And what kind of services do people get connected to?
So social prescribing is when we join the health and the community social sector so that we can address some of the non-medical issues that can actually affect the health of older adults. So this is actually including community organizations, the community-based senior service organizations that are often funded through United Way. And so these community organizations exist everywhere throughout the province. In all of our communities in Fraser Health, we have a social prescribing program where primary care providers or healthcare providers from Fraser Health can make the referral. And the community connector, who is located in one of those community nonprofit organizations, will contact the older adult and their caregiver and find out what needs they may have. They may have been referred because they have problems with not being able to exercise. And so often practitioners have written down on a prescription, exercise, go to this place and exercise, but that's often not enough. But when the community connector speaks with the individual, they find out what the barriers are, what is getting in the way of you doing the thing that you know is good for you and that your doctor is recommending. So it might be transportation, it might be finances, it might be culture, lack of language, and it may be psychological. So all these barriers get in the way of an individual actually accessing these services that are in the community for other people. So through the community connector, they can actually work to overcoming those barriers. So our community connectors will arrange rides for them. They'll look at community financial sort of banks to see whether they can fund a program if a person cannot afford to pay for the exercise programs. And they'll actually introduce them to all these activities in the community, like this day program, garden clubs, walking clubs, other exercise programs, and hobbies as well. So art and music are great places for seniors to gather.
Yeah, we're trying to keep people as healthy as long as possible at home and in the community. And one of the things that you can do to do that is to bring joy and a bit of fun. So recently a video from the Mobile South Asian Day program went viral, and I think there was a challenge involved there with a famous Beyonce song, and it was the Texas Hold'em Challenge. Can you tell us a little bit more about that?
It worked out very well, and they are so happy too, like seniors so happy to done that, and they are so famous.
Yeah, over is it not like hundreds of thousands of people that's seen that clip?
They are very famous now. Our program is also, and they're after 2 days when is the video, people seen the video, when they going for a walk, and then they And then the people they are calling, the girls and the kids, young kids, they are asking, "Hi, Uncle Ji, I saw you on the video." This is the good connection too. Like the young kids, they watched and then they know too. Like they feel so good. And they had a phone call from the countries, the relative lives out of Canada, they're living England, America, India, so they're calling from states and they say, "Oh, where were you guys? It's so much fun. I see you're dancing, laughing." And we feel so good and they feel so good.
That's wonderful. That and it, like that there was a further connection with their community beyond, as well as intergeneration connection. And we talked a lot about keeping people healthy and as long as possible in the community with all the supports that we spoke about. What happens once, the family feels like, okay, we've tried our best, but it doesn't seem like it's enough? What does Fraser Health offer? What are the next steps?
So as long as possible is different from individuals and their families. And we know that family caregivers are so important and integral to keeping seniors well in their own homes. And so the services that we talked about actually support them to be able to do that for as long as possible. And bringing in the respite is really helpful because it allows the caregivers to carry on. And so assisted living is where they would have meals prepared for people, their housekeeping, their laundry services provided, as well as some in-house activities like exercises and supports. So that would be for people that really need that level of support to be able to carry on, and that becomes their home. And then when they get to a point where they might need around-the-clock nursing care, if they need help with mobility, getting out of bed, and things like that for activities of daily living, then they might need to consider long-term care services. And that would be something that they would transition, and they're monitored over time with a nurse that would actually look at their level of function and then indicate when they might need to move to those sites.
Yeah. And you also touched on family members and loved ones being a partner in this care journey, and especially ensuring and supporting our seniors to stay in the community at home as long as possible. And Paramjit, in the South Asian community, that support and that intergeneration connection is quite strong. So what are some of the examples that you have seen of how families and loved ones support their seniors?
As our community, we are living all together with the kids and in-laws, parents. So I seen like their great grandkids they are coming with when their parents are dropping, their grandparents. So the little kids, they are coming with the dropping great grandma. So they are telling, the parents telling, "Oh, mom is going to her school." So this is her school. This is the connection. They are still together.
And Grace, I think that kind of intergenerational connection and the positivity and impacts on health is also why we now put daycare, like children's daycare services built into long-term care as well. I don't know if you're able to speak about that a little bit.
I think having intergenerational contact is so important and is so wonderful in South Asian cultures to still have that as a really strong component. But where we don't have that, we really want to sort of make that available by having young daycares, so students and children available, and very in close proximity with long-term care facilities where you have older adults there. And so that they might be participating in a garden together. And so there's that sharing. And so that allows the younger generation to be aware of the older generation and their needs and how they can actually support them and make that part of their lives as they grow up, which I think is really important. And then for the older generation, of course, they are so revived by having the young children around. And that again gives them purpose to be able to look forward to those interactions.
Great. And you talked earlier about kind of campus of care. Sometimes independent living, assisted living, and long-term care are all in a close proximity. And I don't think we touched on independent living as much. Are you able to explain how independent living is different than assisted living and long-term care?
So independent living is for people that are more capable of supporting themselves, and so they don't actually have, say, on-site nursing service, that kind of thing. So it's basically having a community of people living there, and they may have meals provided, a community dining room, say, but really for people that are quite independent still and don't need a lot of help. Gradually, though, they will recognize that they might need help with, say, medication management because they're becoming forgetful, or they'll learn because of people that are in other facilities like the assisted living sites, and know that they might need to get that kind of care. So I think being in a campus of care is really helpful because they develop those relationships and friendships where they are. And if they have to move to a different building, it's not that far from the relationships that they formed before, and then they form new ones.
And how do people access these services?
Yeah, so it's difficult because there are limited number of beds, you say, in long-term care, especially because that is where the most resources are required because they have nursing support around the clock. Assisted living, of course, they have some nursing support and some care aid support. And so if a person is starting to decline, and again, hopefully they have a family doctor, but if not, they can call Fraser Health Home Health Program, Home Health Service Line, and say, I'm starting to have problems, or their adult child might be calling on their behalf and saying, my mother is starting to need help with this and that. And so then they would get an assessment with a community health nurse who can do a very fulsome assessment to say, okay, these are the needs, and we can meet those needs at home, and we can send in some help, and let's see if this will work for a short period of time, because home is best, and we know that most older adults want to remain at home for as long as possible. But if that is no longer a possibility, then they would be put on a wait list unless there is an opening, unless they want to go privately. That makes it a little bit faster. But if they want to go into a health authority facility, then they would be followed over time and services put in place before they get into a facility.
And Paramjit, I saw you nod quite vigorously when Grace mentioned that home is best. Do you hear that from your clients?
Home is the best, so they are living in home. If we try to keep them active, like they can stay at home how long they can, and then they stay healthy. So yes, home is the best.
And I'd like to add to that. So home is best, and we know that older adults want to stay at home because that is their life. That's where they've built their families, their memories. They have pets. They do not want to go into a facility. But really, it's the caregivers that are burning out, that have problems meeting the needs. So we do our very best to support them at home. But when a referral comes through, we are very mindful of the family caregivers, and we make a referral to family caregivers of BC that can support them in the community. And then we also have practitioners in home health that are caregiver liaisons, and they will actually connect with the caregivers to make sure that they're doing okay, put in as much respite services as possible, connect with Alzheimer's Society if the older adult is suffering with dementia, and provide them with that kind of support and education. And education is a huge part for caregivers because they need to know how to navigate the system.
How do people find out more about caregiver supports, and are there ones that are more culturally sensitive? So maybe I'll start with you, Grace, in terms of how do people actually find out about some of these caregiver supports?
So even just connecting with home health and Fraser Health Authority and talk about how difficult it is to continue to support your elderly parent or your partner because your own health is declining, that will trigger a referral to the home health caregiver support individual. And so they'll be able to get that kind of access and look at all their other services that might be helpful to them. And then if they're in the community, they can actually just call BC 211 and say, how do I get some help for my mom? And They're not yet eligible for home health because, they don't have quite those needs, but I'm having a difficult time. So BC 211 has a repository of resources according to the geographical area, so they can actually find out what organizations are around that can help them. Maybe they can get a volunteer to do some friendly visiting and give that caregiver a couple of hours off so that they can go off and do some exercise or something else that might rejuvenate them.
I want to make a strong note for 211 and family caregivers of BC, because I think we don't want to wait until, seniors get frail, and we certainly don't want caregivers to get burdened and ill before they actually seek help. We actually want them to be proactive in looking for us supports before they get to that point. So I think those are really great resources for people that are listening. What about other supports in the community for South Asian communities? Are there supports that are available before the caregivers feel like they're getting ill or not able to handle things? Are there things through Archway or other communities, community agencies?
We have organizations, nonprofit organizations like Diversity and PIC, and they actually address a lot of culturally appropriate services for older adults in the community. So we have that in Surrey, and then in Burnaby and elsewhere we have Mosaic as another organization that's very multicultural. So call Mosaic and say we're of a Chinese descent and we need to have appropriate meals delivered for my mother who can't cook for herself anymore and I'm not able to. So they can help to make those things happen.
Yeah, I imagine all of those services you can get through 211 or the caregivers of family caregivers of BC. So trying to ensure that people are very familiar with the resources that they can seek. And I'm sure through the work that you've done, there are many stories of families or clients or patients that's touched your heart. Is there one that stands out for you, Paramjit?
I can't even say one. There is everyday one, right?
What was the most recent one?
Recent one, we went to the lake, and then they were saying, "Oh, can we go to the water? Can we walk close to the water?" Because they never went to walk. So that's what we feel it. Oh yeah, sure, why not? You can. Yeah, so otherwise they tells us their life stories. They tells about their past. They share everything. So we feel so proud, they are sharing everything. They just burdened in their heart. So they tells this is the spot for them. They can share stuff. So every day is a new story. So the family tells us they are calling. They are excited to come. Okay, tomorrow I'm going there. They are ready the day before. Okay, tomorrow is my day. So we are going there. So that feels us special.
Great. Grace?
I have many stories as well, but I have one in particular that touched my heart, and I remember it very well. It was a man in his early 60s who was living alone and quite isolated and had started developing some depression. He went to see his nurse practitioner, who was his primary care provider, and spoke about his depression a bit, but he really wasn't interested in taking any medication for it. So the nurse practitioner spoke to a colleague in the clinic, a social worker, who referred him to a community organization. And so they came to a community organization that provided services for seniors. And the referral was, he's depressed. Maybe he needs exercise. So through the intake process, the community connector spoke to him about what's on his mind and what's really important to him. And is it really exercise, and do we need to help you to get exercise? And he says, well, that's a good thing, but right now I'm facing eviction because a landlord just raised my rent and it won't be covered by my income. And so I'm looking at being homeless, and that's the biggest thing on my mind. And so the community connector was able to look at all housing options for him and help him to actually find something that was affordable and get him moved into something that was affordable and that he could stay in for a long period of time. And so in doing that, his depression improved significantly. And because he had developed a relationship with the community connector at this organization, he started thinking about, well, what can I do to give back? How can I help you? And he was a musician from a long ways back. He used to play the guitar a lot, but he hadn't played for many years. And so between himself and the community connector, they actually started a music program for seniors that come to the organization, and they called it The Heart of It.
Oh,
They
the
did.
same.
That's right. They called it The Heart of It, and they invited seniors to come and play whatever instruments they wanted, and also to read poems and bring any arts that they wanted to display and discuss with the group. And so he was part of this, and he brought joy into his life by giving to others his own skills and his own strengths. And so that was really heartfelt for me, because this man found a meaning in his days, in his life again. He had something to look forward to, that he was helping others, and the rest of them all participated, and they gained as well from participating in a medium that they found enjoyable. So music and the arts, and interacting in a socializing setting.
Thank you for sharing, Grace. Maybe I'll start with you on the next question. What's the one word that you would use to describe our future of healthcare, and why?
Opportunity. And that's because as we're learning more, and as we're integrating more, and as we're understanding that the aging journey is not just about healthcare, it's about the whole world, the whole society around us, that we have the opportunity to share and learn from each other on how we can make life easier for older adults, and how we can empower the older adults to live their best life possible, and to be able to stay at home as long as possible.
Opportunity, just very much attuned to what you talked about today too. And you, Paramjit?
I have a learning.
Okay.
So we wanted to learn more about our health system, and also we wanted to give it to our new generation. So, and like to keep our generation and our seniors or communities connection together, and keep them safe and healthy. So learning is never ending.
What a beautiful way to end a lovely episode, to learn about what you're doing in our communities for our seniors, and how we can proactively work together to ensure that we're keeping people in partnership as healthy and as long as possible where they want to be at home. Thank you so much.
Thank you so much.
Join us next time as we continue to get to the heart of healthcare. Don't forget to rate and subscribe to this podcast. The Heart of It is produced by Fraser Health Communications and Public Affairs.